Yep, already started.
Okay, thanks. Okay, so I want to welcome everybody to our March webinar. I'm really excited for this month because we have two of our students that are going to be presenting. And I'm going to start. Joan is going to present first. So Joan is a student in our Master of Professional Studies in Homeland Security Public Health Preparedness program. And when she's not a Penn State student, she works full-time as a web developer for the College of Medicine, following her 16-year career in multimedia journalism. Her investigative report on the first Lassa fever death in the U.S. was named the best news feature in Pennsylvania in 2015, and it was that project that led her to explore Lassa's impact in Africa as a grad student. Following graduation in spring 2019, which we are super excited for her for, she intends to continue integrating her communications expertise with her knowledge of public health policy to help further the emergency preparedness efforts of Penn State's College of Medicine and its affiliated health system. So Joan, I will turn it over to you.
Excellent, thank you so much. I'm really looking forward to talking with everyone today. If there are any questions or anything like that, please feel free to either use the chat or use the raise hand thing in Zoom. I can see those. What I'm going to do specifically, I'm getting ready to go to Australia to the WADEM conference. That's the World Association for Disaster and Emergency Medicine. That's in early May. Kat is going to that as well. And I'm going to kind of talk through the poster that I'm going to present there. Hopefully you can see, actually, here's the preview of the poster. Don't go telling anyone because you're not supposed to share those, but this is the poster and this is what I'm going to present. And I'm just going to kind of go through some of the things in the research, but specifically I'm going to focus a little more on how I came up with this topic and how I got involved in this, because one of the things that's happened is I've had friends go through the PHP program and friends who are in other graduate degree programs. The question that I keep getting from people is, well, how do you find something to research? How do you know what you're into? And so I thought I'd talk a little about how I got there on this project, because quite honestly, that's the most interesting thing about it for me. So the research is cool, although, of course I'm a little biased because I've spent an awful lot of time on it. So the project itself is on kind of the coincidence of Boko Haram terrorist activity in Nigeria, as well as a Lassa fever outbreak in Nigeria. And just to give a very, very broad background, Boko Haram has been active in Nigeria since 2009. When we were doing our, I think it's HLS, I don't remember the course number, one of our required course numbers, I think it's 805, where you talk about the dynamics of terrorist organizations. Boko Haram was the group that I researched there. And I researched that group because one of my classmates, who is in this degree program as well, is from Nigeria. And I had been talking with him and he had been telling us about all the problems they had. And I thought, well, if I'm going to look at a group for the entire semester, that's affecting someone that I know, that sounds interesting. And so I did all this work on understanding what was leading to kind of some recent upticks at the time, this was 2017, in violence from Boko Haram. And there were a lot of factors. And so I did that project and it was really cool and I was very excited about it. And then it came time to work on my capstone project. And I thought, well, hey, it's 2018 now, and I'm hearing all this stuff that Nigeria is having the worst Lassa fever outbreak, that it's had since the virus was first described there in 1969, and that's where it's from. And I happen to follow Lhasa, and I'll talk a little about that. But so I was like, hey, I wonder if these things are related. And so let me just tell you something really cool, which is that I had this great idea for a paper, and I was going to talk about how these things were related and how one caused the other, and it was going to be wonderful. And absolutely none of that was true and none of it happened. So the project that I'm going to talk with you about tonight really is basically an example of sometimes you have a hypothesis and then you do research and you need a different hypothesis. So that is where this paper came from. So Jen gave you kind of the overview about me. I am in the MPS program. I'm getting ready to graduate. I work for Penn State as a web developer at the College of Medicine. And as she mentioned, and as I said in my bio, I actually spent 16 years of my career doing multimedia journalism. I was an editor for a newspaper in Pennsylvania. And one of the things that I was able to do was report on this really cool story about Lassa fever in the United States. And what had happened was I was reading this, the reason I'm in the PHP program is I love to read about diseases. I'm one of those people who will pick up a book on somebody bleeding from their eyeballs and read it while I'm eating dinner. So like, that's fun for me. And so I had picked up a book called Fever, and it was a book that was written in 1970, just as Lassa was first being understood and described. And so Lassa is a viral hemorrhagic fever, kind of like Ebola. Unlike Ebola, it is a little less contagious, and it is a little more catchable and treatable early on. But like all the VHFs, it absolutely is hard to distinguish from other diseases like cold flu. It is a rodent vector disease, so it's carried by one of the African rats. So it's endemic in Nigeria and some of the other African countries. And so at the time, though, that it was described in 1969, they were experiencing in Nigeria something that was new. They had not experienced it before. And it's very much like the Ebola situation in the DRC right now. People were getting sick. It was spreading like crazy. Doctors and nurses were getting sick. And long story short, there were some folks involved at Yale who were doing research on Lassa who had been in Nigeria, who brought the disease home with them, both in people and in lab samples. And there was a gentleman who was working in one of the labs up there at Yale, and his family was from York, PA, where I live. And I'm reading this book on Lassa, again, written in 1970. And in passing, it mentions that this gentleman, whose name was Juan Roman, he came back to his family's home in York, Pennsylvania, and he died there over Thanksgiving in 1969. And I'm reading this book and I'm thinking, you've got to be kidding me. That's my town. Like, I didn't know this. And so I did a whole bunch of digging. It kind of went nowhere. And I wrote an article on one of the newspaper's blogs about it. And I said, hey, if anybody knows about this, I'm really interested. I'm trying to do some digging and I want to learn more. And about 2.5 years later, the niece of that man contacted me. She's somebody who's well known in the Hispanic community in our area. And she served as my translator, worked with his family in Puerto Rico and here in the United States. And it was really cool, basically 40 years after he died almost, to be able to start talking about this man's life. He became the first person to die in the United States of Lhasa. And it was fun. It was an amazing project. And so from that point on, Lhasa has been something that I followed. So again, that's sort of how I got into this project. I started looking at Nigeria. I realized there was the Boko Haram problem. I realized that there was the Lhasa problem. And so the objective that I was going for, like I said, originally my intent and what I assumed was the case was that I was going to be able to show that these things were related. That, like as an example, that people weren't able to get treatment because of Boko Haram activity and they weren't able to get treatment for Lhasa and it was spreading and so on. And it turns out that was not the case. And so what I ended up trying to do was to figure out, are these things temporally related? Are they spatially related? Are they happening at the same places? What are the things that are causing each of those? So the questions that we ended up looking at, and I had a lot of help from my co-authors, that's Jean Langrich, who's on the call with us today, Gavin McGregor-Skinner, who's one of the other instructors in our program, as well as several people in Nigeria, including a doctor with one of the ministries of health down there. And so they helped me really narrow down some good questions to ask. And so what we wanted to talk about what are the connections? What are the potential causes between both of those problems, right? And so that got a lot into the socioeconomic dimensions and the political dimensions. And there are a lot of issues that are going on in Nigeria that don't seem to be directly related, but that I found out through research and through some interviews were specifically impacting both of these areas and causing, in some cases, these problems to be exacerbated. And so then once we took a step back and said, okay, what are the things that are feeding into this? The real question, and you know, we like to think that we don't do research just to do research, right? We're trying to figure out how to make something better, how to make an improvement. And so what I ended up spending a lot of time doing was thinking about, what are the preventative measures? What are the mitigation strategies that can address some of the public health impacts of these problems in a nation that has limited resources, and in a case where what we don't want to do is solve one problem by making the other problem worse. And that is something that not with these two issues specifically, but that's something that's been happening in Nigeria in large part. Things will be done to fix a particular problem, and that will divert resources, that'll divert time, that'll divert attention from another issue. And so suddenly now you have this other big problem, where you maybe didn't before. So we did a couple of different things. This is mixed method study. That means there was both quantitative and qualitative analysis that we did. Quantitatively, we looked at two sets of data. And first we looked at the Armed Conflict Location and Event Data Project, that's ACLED. For anybody who's doing any research into terror or geopolitical violence, ACLED is an amazing source. They report just about everything that's out there in a great level of detail, describes the actors, describes the type of violence, whether it's an insurgency, whether it's a governmental action, whether it's a police action, whether it's a person-to-person conflict, and absolutely tons of stuff that you can find there. And so we looked at that for all the known Boko Haram activity, and then also the Nigeria Center for Disease Control, the NCDC, was producing weekly situation reports on Lhasa. And so they did a lot of data analysis themselves, but we did some secondary analysis based on the reports they were putting out. And so we took those data and we mapped them. And a lot of what we were doing was looking at, okay, where are these things happening? Nigeria is a country that has 36 states. They're widely spread out. And we wanted to kind of get an idea of, okay, what's the overlap? Where are things happening? Why might they be happening? The other thing that we did was that qualitative analysis, and that comes out of my journalism background. I'm really used to getting information by interviewing people. And so it's interesting to me in scientific research, which I was fairly new to when I joined the PHP program. It's interesting to me the number of studies that are done that don't necessarily draw on first-person interviews. And sometimes that makes sense depending on the type of work that's done, but especially when we're talking about things in the public health space, it seems to me to be really useful to get some background, to hear what people are thinking. And so what I was able to do was to reach out through some NGO contacts I had, and I found this group of aid workers in Nigeria. And some of them were working specifically with Boko Haram, and others of them are medical aid workers who are just working in the country in some different mission type projects where they're all over the country. So I did some email interviews with those folks. Some of them became great sources for me. Some of them gave me just some good background data to work from. That did bring up some limitations though, because we did some qualitative assessments. They were personal interviews. Obviously the things that I'm talking to people about are going to possibly introduce some bias. The interview subjects obviously have their own ideas. Many of them are medical professionals. Many of them are human rights advocates, but most of them are not research scientists. So they obviously have their own thoughts, biases. They're not, Nigerian political experts or anything like that. I specifically looked at 2017 and 2018. And so because of that, the amount of peer-reviewed literature that was available isn't super high. And actually at the end of my talk, I'll give you some links to read more. In the early report from the CDC's Emerging Infectious Diseases publication, there was a notice that came out just last week on a group of people who did a study of January to March of 2018 on Lhasa and the endemicity, and it just came out in EID this week. So you can see that I'm kind of playing in the space where all of the stuff that's being written, now's the time that it's being written. So some literature limitations there, but we were able to work around that. And the interview subjects, obviously, they all came from similar backgrounds. Some of them knew each other, so there's some collective belief there. But so what we tried to do is narrow down what's going on with Boko Haram. And so the biggest things that we found, and none of this should be surprising, anybody who's dealt with even the basics in understanding terror organizations, is that socioeconomic factors are really the primary driver in a lot of those areas. So in Boko Haram in particular, a lot of younger Nigerians are unemployed, they're experiencing a lot of financial trouble, and in certain areas of the country, and we'll look at this when we look at the map, there are just, the lack of options is hard to describe. And so it was great in my interviews to really talk to people who could give me a picture of what that looked like. And so a lot of that turns into a driver for radicalization, right? So not only do people turn to organizations because they have a better opportunity for food, for income for their families, things like that, but it's also easy for them to become angry at the existing government, become angry at other people in their country who they feel are leading to these problems. And so food insecurity is obviously a big piece of that. The other big factor in Nigeria is that as I was starting to do all this research, there were a number of elections that happened in Nigeria, and there was a large presidential election in 2016. And there were a lot of changes that came out of that led to some increase in terrorist activity, especially in 2017, and then leading a little bit into 2018. And so moving forward, one of the things that's going to happen is there will be an election in 2020. And so a lot of people are really starting to do some analysis on what might be coming there. And so Lhasa, we talked about, what Lhasa is. There are starting to be some studies that have come out about why was the 2018 outbreak so bad. In the first 3 months of 2018, there were more cases than all of 2017 and some of 2016 combined. So definitely just a huge uptick in that. And everything in the literature is suggesting that there's nothing in the virus itself that has changed. We're not looking at a new strain or anything like that. Everything is showing more zoonotic transmission. And so there are a lot of things that exacerbate that, right? We talked about rodents being the vector. If there are conflicts, man-made conflicts especially, you will see a lot of disruption in the animal population. In general, if there are difficulties within the health system, you will start to see people get more and more zoonotic disease. In general, again, when you're talking about a country that's changing, and so when you talk about things like deforestation and all, you start to get this increased contact with vector rodents that maybe were not in quite as close proximity with people as before. So all those things work together, and we ended up with, okay, we have this high level of terrorist activity, we have this high level of zoonotic transmission for Lhasa, and we wanted to look at where those things are. And so the maps that you can see right now, the one on the left shows areas of Boko Haram activity, and both of these maps are January to June of 2018. And so, and I will say the reason that period is chosen is that January to June tends to be the Lhasa season, as it were. So it was a good focal point to look at in mapping data. So the map on the left, you can see the Boko Haram activity is really centered in the northeastern region of the country. Specifically, you can see some of the states up there that are very heavily affected, and then some scattered attacks elsewhere. And so you can see that really focuses really in just part of the country. But then when you look at the map of suspected and confirmed Lhasa cases, you can really see, hey, there are a lot of cases, there's all but one state actually had at least suspected cases reported. Several states had at least some confirmed cases reported. And then you can see a few states, and again, this is more concentrated toward the south central or southwest part of the country, some states that had a large number of confirmed cases of Lhasa. And I will mention too with this, when we talk about the suspected and confirmed cases, one of the challenges in Nigeria is that up until partway through 2018, there were only 2 labs that could confirm Lhasa. So when we talk about the difference between suspected and confirmed cases, we have, I think we have an American mindset about that, which is that if something is not confirmed, that it probably wasn't a case. In this case, the strong guesses that came out of the literature were that there were many, many more even suspected cases than were recognized, and certainly there were many more of the suspected cases that were very likely to have been confirmed if there were better lab testing available. So again, you can see that covers huge portions of the country. There's only one state that wasn't affected by either issue. And so again, this just summarizes some of those data. We talked about where those cases were. The other thing that we looked at as we sort of mapped those things, if you look at the map, 6 of the country's 36 states were extremely impacted by one of the 2 issues. So this would be the darkest shaded areas here. And that's a big deal because you're talking about 1/6 of the country that's having this extreme impact from a public health issue. And then 24 additional states had at least a moderate impact from one or both. So you're talking at that point, 30 out of 36 having at least a moderate impact from one of these big issues. And so we looked at these data and we tried to kind of put together some literature review. We tried to put together some of the things that people had told us in our interviews. And we tried to say, okay, so what's really going on here? We did not document any kind of causal relationship between the Boko Haram activity and the Lhasa activity. So again, that's what I went into the study, determined that I was going to prove, and what I proved is that that doesn't seem to be the case at all. But I also found that there's nothing out there in the literature yet that talks about the intersection of these two things. And there is an intersection, and it's super important because we're talking about every one of this nation's states being affected by the public health challenges of these conflicts and diseases and things like that. And then we started to look at, okay, well, why? What's going on? And we really looked at a lot of the socioeconomic factors, economic insecurity, food insecurity, an overburdened government, a lot of reports of government corruption. Those were the big things that we found drove increases in both of those areas. And again, supported that through the literature, and our own interviews as well backed that up. And unfortunately, what happens is that those same causes, so economic insecurity, food insecurity, they tend to worsen radicalization, they tend to increase presence of vector rodents. Unfortunately, the challenges that they cause, so then there's more terrorist activity, and then there's more Lassa virus activity. Those then in turn drive more food insecurity. They drive more economic instability. And so you start to get this vicious cycle in which now your original causes have created a problem. Those problems feed into the original causes. And so now we just have this situation that's just really hard to get out of. And so the goal of our project was to really look at that and say, okay, well, what are we going to do about that? And the biggest thing that we looked at is that a combined approach, and we read some papers around some concepts called hybrid doctrine. And hybrid doctrine basically says you can't win a war on one front. And so in general, where things have failed in Nigeria in the past has been when they're very single faceted. So there have been measures in Nigeria to deal with government corruption. And that sounds great, and we are all for ending government corruption, but those areas don't look at the country's economy. And so they'll make these suggestions, and they'll put forth candidates and so on that just aren't, their platforms aren't sustainable from an economic sense. And so they're looking at trying to fix an area, and it's just not meeting all of the needs. It's not addressing the whole climate. And so there are things like that around the economy. There are things like that around education. And obviously, if you're familiar with Boko Haram, it translates loosely to the phrase book is forbidden. And it essentially is a very anti-Western education philosophy that drives that group. And so that gets really complicated because a lot of the measures that were put into place to improve education in Nigeria actually drove increased radicalization. And so it's great, we want to fix education, but we need to do that in such a way that we're not creating this larger problem. So some overarching measures around the economy, around education, around public health in Nigeria will absolutely be important. We want to talk about things like that, what can be done. But we also want to look at the individual strategies as well. We don't want to do those things in a vacuum. So overarching measures are great, but we need more laboratories for Lhasa testing. That's just a thing that we need. We need increased training on how to get people not to have multi-mammoth rats in their house, how to keep them out of their food. Those are things that are specifically targeted toward Lhasa. We need approaches that deal with anti-radicalization measures for people who are involved with Boko Haram who can be removed from the organization. So those are individual. They don't directly affect each other, but if those are done in concert with some of these overarching strategies, you really start to get more benefit and fewer, I'll say, negative side effects or negative consequences. And specifically, trying to avoid incomplete mitigation efforts that have tended to worsen things. And one of the challenges there is that there was a point in probably around 2013 or 2014 when Boko Haram numbers dropped off sharply, and a lot of the NGOs kind of had the impression of, we've done it, we've beat them, like this is on the way out. And so unfortunately, as is the case, there were other problems to solve, there were other things that needed funding, and a lot of the NGOs pulled out, and the Boko Haram activity ramped up higher than ever. And so that idea of making sure that there's adequate follow-up is a big part of what we're pushing for out of this research. Speaking of research, there are a lot of next steps to do in research on this project, and if there's anybody listening who is interested in this, I would love to talk to you because I have a ton of ideas of where I'd like to go with this as well. Obviously, we want to look at all of 2018's data. This project was completed in the fall of 2018, and so there's more to tell from that year. And I would really like to look at the January to June 2019 period that we're in right now, because the studies that are coming out and the data that are coming out right now from Nigeria show that this year's Lhasa is even worse than last year's. And so this story is not getting better. There's definitely an increase still going on, and we really want to kind of see what's happening there. And so that's something I'm really keeping an eye on. Budget and where the money is. It would be really nice to look at Nigeria's budget and the budgets of some of the NGOs that are working in Nigeria, specifically related to the allocations for fighting Lassa and fighting Boko Haram, because a thing that is going to continue to be a problem, again, is this idea of limited resources. Where are we spending money? Is spent in one area, taking from another area? And specifically, this ties into the next topic. There are other things that are going on in Nigeria, including in the Niger Delta, which is in the southwestern part of the country. There are a lot of militants down there, and there's a lot of things going on down there around mining and militant action. And those are also a big part of when we talk about the correlation between public health and violence. That's another really huge area. And so to expand the analysis, to look at what regions are affected by that, what are the potential causes, we really start to build this interrelated geospatial look at what are the problems in Nigeria, where are they, what's the what's the co-incidence and what's the correlation. And specifically with Boko Haram, there have been a number of papers out on the effects of Boko Haram activity as it relates to specific health outcomes. So HIV is one, childhood wasting disease is one, polio eradication is one. And so there are a lot of papers around that. And I'd just like to see more work be done on some of the other health outcomes. As I mentioned, I've not yet found anything in the literature that looks at Boko Haram and Lhasa together, and I'd like to see some more work be done on that. I am working on submitting a paper that would wrap up a lot of this research following the conference. So I'm hopeful that I can start to get something out in that space. I do have some suggestions for further reading. I'm sure these slides will be available after the presentation. I mentioned there's something new in EID about Lhasa from last year. The World Health Organization talking about how Lhasa is worse this year than it was even in 2018. A link to look at some of the data in ACLED, status updates from the Nigerian CDC, so that includes the reports for this year, and then a link where you can read the story that I did on the first Lhasa death in the United States, which is just a ton of fun and incredibly sad, both. So. And then I just want to say thanks to all the people who've helped me get this study together. That includes a number of folks here at the College of Medicine, including Jen Osatek, who's been amazing. And thank you very much, Jen, for inviting me to speak. Some other folks elsewhere in Penn State, and some of the people I've worked with through various NGOs, as well as my family, who have had to spend an awful lot of time listening to stories about how people die in Nigeria. And so the only thing that they're happy about right now is they've managed to stop me from going to Nigeria directly in the next couple of months. So they're just trying to keep me safe, but I want to be there and I want to learn more. So we'll see how that works out, but I do thank them for their patience as well. So I think that that's pretty much what I have. I'd be glad to take any questions if there are any, but I also would love to turn it over to Kat to hear about her work as well.
Joan, thank you so much. That was a great presentation. And so I'm going to turn it over to Gene right now because I know he had at least one.
Excuse me.
Okay. Hey, Jen, can you hear me now?
Yes.
Good, good. Yeah, just again, great presentations, both Joan and Kat. Thank you very much. I'm really proud to be a part of this program and hear you all presenting. I'll try to, this sort of applies to both, but I think I'm going to direct it more towards Joan since her hypothesis really had to do with surveillance. But I guess I'm just wondering, just because you didn't find, just because anybody didn't find evidence to support their hypothesis on one study doesn't mean that it's necessarily wrong. It just means that there's one study that doesn't support it. So I guess I'm just wondering about the surveillance system. So how good is the Lassa fever surveillance system, particularly in Nigeria? I guess I'm wondering about sort of sensitivity of being able to detect those. Could it be possible that Boko Haram disrupts the reporting or the diagnosis of them? And therefore, that's part of the reason that you don't see the association. And I guess the other is just the timeliness of them as well. So is there an issue with timeliness of reporting? And so maybe what we should be looking at is more of a lagged feature between the activity and the evidence in the surveillance system. I think this is the issue around surveillance is important to CAT as well. You know, infectious disease and generally has a fairly low capture rate. But anyway, Joan, just what do you think about that? Do we have a good enough surveillance system to really rule out this hypothesis?
So absolutely not, and that's a really great question. I would say there are a few factors that are at play. I think that there are a lot of good procedures in place for, I'll say, basic surveillance. So because it's, you know, it's Africa, because they know Lhasa in particular is endemic, people are looking for it. The interesting thing is that people are looking for it where Lhasa has always happened, which has generally tended to be clustered in that sort of southwestern and south central part of the country. And so in those areas where they already know Lhasa is a big problem, there's a really pretty good surveillance. And at least it gets as far as samples being sent to some of the diagnostic laboratories. Now, that's sort of what I was talking about, where things fall apart between suspected cases and confirmed cases. Because I think here in the US, if we had a bunch of things go to diagnostic labs and we only got a confirmation rate of something like 10%, we would say, okay, this is probably not as big of a deal. In this case, there is a huge delay in processing. Some things do not make it in usable testing format to the diagnostic labs. Like I said, there were only two. A third one opened up last year, and that did improve it. So there's some work in the literature that actually says the reason there's an increase in cases from last year is actually that that the process got better, that more people were noting suspected cases, that more cases were able to be confirmed, and that's why it looks like things are getting worse when really it might just be an improvement in how things are diagnosed. So there's a question about that. To your point about whether some of that just isn't happening and so we're not seeing cases in the areas worst hit by Boko Haram, that's definitely a possibility. A thing that was interesting to me is that I've been working with, like I said, some folks on the ground doing medical relief work in Nigeria, including a number who work in the northeastern part that's most hit by Boko Haram activity. And one of them just last week, for the first time, got a communication from the, you know, kind of the central Nigerian CDC and some of the government ministries of health saying, you need to be on the lookout for this in your state. And that was not a communication that they had received before. And so if you know, and he's somebody who works in the health bureau up there, if that's not something he was hearing before, were things being reported to their health bureau? Was the health bureau looking at things and saying, yeah, this is definitely this could be Lhasa, let's diagnose, let's take samples. You know, if that wasn't happening before, absolutely that could be a problem. And it's interesting because I talked about where Lhasa is endemic now, but actually the place where it was originally described that led to the story that I was talking about in 1969 was actually in the state that it was the most hit by Boko Haram violence. So it is not where Lhasa is found now, where it was originally found. So obviously, we know we can see it anywhere within the country. So I think that's interesting. I think that's something that's definitely ripe for further research. And like you said, I'm trying to make sure that I'm framing things to myself as I don't know what the connections are yet. And much like with anything else, I think when you're looking at a place over time, pretty much everything is related. It's just finding out how.
Great. Yeah. Thank you. Yeah. I think the issue around surveillance systems, particularly around infectious diseases, is always a question. Is it timely? Is it accurate? You know, what's the delay? And those issues always have to be resolved. Good. That's all, Jen, for me.